Around 15 million people worldwide suffer from stroke each year. Some of the more common risk factors are diabetes, high blood pressure, and heart disease. But recent studies have found that COVID-19 may increase the likelihood of it as well. Experts say strokes can occur in COVID-19 patients under the age of 50 with mild or no symptoms. But understanding the warning signs, its risk factors, and the treatments can make a huge difference. On the program today, we'll talk more about COVID-19 and stroke. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. Experts are warning that COVID-19 may increase the risk of stroke in certain groups. Our guests are here to tell us more about this. With us is Dr. Epifania Collantes. She's a stroke neurologist from the Philippine General Hospital and Manila Doctors Hospital. Also with us is Dr. Ethel Anonuevo. She's a pulmonologist from the Asian Hospital and Medical Center. Now, it is said that strokes are the second leading cause of death among Filipinos and one of the top 5 leading causes of disability. I'll start first with Dr. Epi. Ano ba yung stroke? Why does it happen?
A stroke is a brain attack, so there's usually sudden weakness or numbness in some parts of the body, and the main cause is an abnormal blood vessel. So it can be hemorrhagic or cerebral infarction. So those are the 2 types of stroke. Cerebral infarction, meaning there's a blockage in the blood flow of depriving certain cells of the brain with oxygen, damaging the cells of the brain, and hemorrhagic because of the rupture of blood vessels.
Now, because of the nature of strokes, time is of the essence. Napaka-importante na makakita sila ng treatment agad. And the earlier you recognize the warning signs, the sooner you can get the help needed. Dr. Epi, let's go through the symptoms, the common symptoms kapag someone is undergoing a stroke.
So remember the acronym BFAST. B, if there's sudden loss of balance. E, means sudden blindness or sudden doubling of vision. F means look at the face. Is there asymmetry, facial asymmetry? Then look at the arm. Is there weakness of one part of the body? And then S for speech. Is there slurring of speech? And then T is time. Note the time, and it's time to rush the patient to the hospital. So the acronym is Be Fast.
Okay, so be fast, and early detection of these symptoms is vital in preventing permanent damage. Yun ang ayaw natin. So remember to be fast. Dr. Ethel, let's talk about this one. How can COVID-19, which primarily affects the lungs, how can this be a risk factor for stroke?
Of course, the primary manifestation would be the lungs. Pero there are case series, ibig sabihin po, these are researches that were published, na nag-show na affected din talaga yung brain, the heart, and other parts of the body. I think what the main mechanism would be several things. One is hypercoagulable. Ito po yung nagiging malapot yung dugo ng mga pasyente natin with COVID, and be it mild and most especially the more critical patients, nagiging malapot po yung dugo nila. And what is the mechanism behind that? It could be because mataas yung tinatawag nating mga cytokines, no? Ito po yung cytokine storms. Pero pag nagsa-cytokine storm ng mga pasyente, may symptoms na po sa lungs, no? Hirap huminga, bumabagsak yung oxygen. And if we look at blood tests, nakikita na din natin doon na tumataas siya. One mechanism po yun, hypercoagulable state. There are also postulates na merong direct effect yung virus to the blood vessels, promoting thrombosis or pagbabara ng mga ugat, no, anywhere in the body, and clinically siguro sa heart at saka sa brain. Yun yung sinasabi nila na most probable postulate sa mga pasyente na mild naman, hindi sila nag-cytokine storm, pero nagkakaroon sila ng stroke. But correct me if I'm wrong, Dr. Epi, but in case reports, the incidence of stroke, no, and most especially siguro yung ischemic stroke in patients with COVID-19 is variable but not too high compared to the general population na walang COVID. So parang sinasabi nila between 1 to 6% lang in case series. Again, all the data will be coming out siguro anytime soon, no? Kasi yung mga reports nila would be in the 2020 experience pa lang.
Itong mga symptoms na to, itong mga factors, normally seen with those with moderate to severe COVID can lead or mag-i-increase ang chance ng magka-heart attack or stroke. Now, Dr. Ethel, let's remind our viewers again about the symptoms ng moderate to severe COVID-19 para aware sila because this is where that risk for having a stroke increases.
Alam naman po natin, the symptoms of COVID can be very non-specific. Para lang siyang trangkaso po, no? Lagnat, sinisipon, masakit ang katawan, inuubo. Non-specific, any viral infection can have this. Pero po, pag meron kayong exposure to somebody known to have COVID, alam na natin, increase yung likelihood na COVID yan. The other symptoms would be pag nawala po yung pang-amoy or panglasa, mas mataas yung chance na these are from COVID infection rather than from the other infections in the respiratory system. So siguro, it's more of a clinical suspicion na mag-i-increase yung likelihood. But remember po, no, may magagawa po tayo the first 5 days of symptoms. Beyond the 5 days, yun na po yung papasok yung inflammatory phase. So gusto natin ngayon with the provision of all these antivirals already in the Philippines, no? Dumarating na po sila. I think ngayong November lalabas na yung molnupiravir, no? So all these things po dapat i-address natin yung viral phase or the acute viral phase. Huwag na nating hintayin yung inflammatory phase. So I think suspicion. We need to have a clinical suspicion. Tingnan natin, meron ba tayong nakahalubilo with COVID? And kung meron bang nawala ng pang-amoy or panglasa, high likelihood po yun talaga ng COVID. The others are non-specific.
There has also been occurrences of strokes in COVID-19 patients as young as 30 years old and with mild to no symptoms. Why does this happen? More on this when we return. Stay with us on Med Talk Health Talk only on CNN Philippines. I'm Dr. Freddy Gomez and welcome back to Med Talk Health Talk on CNN Philippines, where caring is our calling. COVID-19 usually attacks the lungs, causing symptoms such as coughing and difficulty breathing. But experts are now starting to worry about another organ, the brain. Even with mild symptoms, many people as young as 30 are experiencing stroke or stroke-like symptoms. Dr. Epi, let's first discuss who are most at risk nito.
Those who are hypertensive, diabetic, who are smoker, who have irregular heartbeat, no, and who are drinking a lot of alcohol with substance abuse, like maybe shabu or ecstasy, those who are high cholesterol levels and are obese.
So, itong mga risk factors na ito, Dr. Epi, as long as they are present, it doesn't really matter how young or how old you are, no? You are still at risk of having a stroke if you have COVID-19 as well.
For COVID-19, we did a study on this. More than 2,000 COVID-positive patients at UPPGH. 3% had stroke, and the mean age was 59, plus minus 14. So younger age, but they had other risk factors like hypertension. But even those with mild COVID, they had also stroke.
Now, people living with multiple risk factors have greater cause for concern if infected with COVID-19. But as we mentioned, there have also been accounts of patients with mild to no symptoms who have experienced strokes. Dr. Epi, what do we know about this naman so far? Yung mga mild to moderate symptoms lang with COVID-19 but still nagkakaroon sila ng symptoms ng stroke.
Yeah. So even those without really hypertensive young patients, because there's increased viscosity, malapot yung dugo, it can cause thrombosis or blood clot in the arteries and veins. So this increases the risk for stroke because of that thrombosis.
Let's talk a little bit about the link between COVID-19 and that of stroke, because stroke typically results from, as mentioned, blood clots. This is one of the symptoms as well as of severe COVID-19, as mentioned earlier, yung hypercoagulable state. Dr. Ethel, can you explain that link between COVID-19 and that of these blood clots that may put someone at risk of having a stroke?
So as we all know, yung COVID po, hindi lang nakaka-apekto ng respiratory system from the nose to the lungs, but also have been found out to affect the blood vessels. And in so many different ways po. Kung mayroong cytokine storms, this is the inflammatory phase. Yung the fact na namamaga yung buong system natin, the blood vessels are namamaga. No? Lahat po ito are all contributory para magkakaroon ng clotting factor. Also, tumataas kasi yung isang biomarker, what we call D-dimer. In most studies, kahit na actually nakikita po namin to sa mga sa mga patients na at least the moderate to the more critical, tumataas talaga yung D-dimer nila. Inflammation marker po siya, but at the same time marker for hypercoagulable state. So number one, po yun, theory na yun ang dahilan kung bakit there is a connection between COVID and stroke. But the other one is a direct effect. So ito nga po yung sinasabi natin na baka ito yung mechanism behind mild COVID patients na they didn't have symptoms at all na respiratory, hindi sila nadadala sa ospital until they manifest with certain things like stroke po.
Now, we're aware that the loss of smell and taste, headaches, fatigue, and brain fog are some of the symptoms na pwedeng maramdaman ng isang taong positive ng COVID-19. This has led some experts to believe that the disease may cause some neurological problems because of this. Dr. Ethel, meron din bang connection kapag merong simptomas na ganito na nakita sa isang pasyente?
Ang affectation kasi sa nose and sa taste, sa tongue, is actually not directly affecting the nerves. Pero namamaga po yung mga cells, surrounding that blood, that nerve ending, that may supply yung sense natin ng taste and smell, namamaga sila, and that is the direct viral effect, no? Kasi yun po yung una talaga, nose and throat, no? So whether it affects the nerve itself, hindi natin talaga alam. What we know is apektado yung gilid. So namamaga po yung gilid na kung saan nag-enter yung mga nerve endings natin. What about the brain? There are reports of pathologic examination of the brain wherein they saw viral parts, no? So ibig sabihin po nun, siguro meron ding invasion of the virus to the brain. But most ang talagang nare-report is really the cytokine storm or pagmamaga or inflammatory phase na nakaka-cause ng lahat ng ganitong mga simptomas.
I'd like to ask, for those viewers who by now probably think na baka nag-worry sila, they might have to take a blood test or something like that, especially whenever they're positive also with COVID-19. Is it practical to include in a blood test their D-dimer even though they don't feel any symptoms? Maybe they might think that this could be a marker for a possible risk factor for stroke. Is it practical to do that?
You are right. So once a patient has symptoms and admitted in a hospital, there are panel of tests, and one of the tests is D-dimer, which has a prognostic significance. An increase of that will increase the risk for stroke and other maybe cardiovascular events also, not only stroke.
Now, what are the best ways to manage and monitor COVID-19 related strokes? We'll discuss that after a short break. Your health is our mission here on MedTalk Health Talk. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Strokes can happen without warning and can result in severe and even permanent damage. Again, understanding the warning signs and getting timely treatment can make all the difference. Remember to be fast. Balance eyes, face, arms, speech, and time. Dr. Epi, how are strokes usually diagnosed kapag dinala na sa hospital ang pasyente?
So when you go to the hospital, CT scan is immediately done after assessment. So we'll differentiate bleed between bleed and infarction. So in other hospitals, they use the MRI.
So when it comes to stroke, Dr. Epi, a lot of people still may be wary into going to the hospital. Baka COVID hotspot ito, baka mahawa sila ng COVID if they're not. Should this be one of their worries? Or is stroke such a serious condition that dapat dalhin na kagad sa hospital?
dapat dalhin kaagad sa ospital because it's reversible. No, so kung hindi ma-reverse, there's great disability. No, so dalhin kaagad sa hospital even in the times of COVID kasi may health protocols naman. No, so na fina-follow. So kaya careful yung mga doctors, no, and then you will be screened also there in the ER.
Dapat dalhin sa hospital. Now, speaking of the treatment for that and it being reversible, once diagnosed, Dr. Epi, the neurologist we can administer treatment right away. Tell us more about this. What type of treatment is administered and how reversible is it? Pwede bang bumalik ng 100% ang pasyente?
Yes, pwedeng bumalik 100%. Like if there's a blockage in the blood flow, there's a clot buster, RTPA, being given within less than 4.5 hours. Yun ang golden time to save the cells of the brain. If it is given immediately, nag-open up yung blood vessel, the oxygen flows again, saving the brain. So yun yung, pwede yun. Kung bleed naman to, pwedeng i-control din yung hypertension. So diretso ka agad sa ospital dapat.
Now, Dr. Ethel, does the treatment change for stroke kapag yung stroke ay caused by COVID-19?
Okay, there's no difference. There's no difference except that there are health protocols that has to be takot lang talaga tayo sa COVID and then the occurrence of stroke. But from what I've known and from what I've seen in most of my patients na merong stroke, hindi po nagbabago yung management. If this is a bleed or a big infarct, kailangan i-manage yung hypertension, kailangan i-manage yung hydration. So dapat well-hydrated or hydrated enough yung mga pasyente para ma-maintain yung good blood flow and good blood pressure. So ang isang problema kasi natin po sa COVID, mababa talaga yung mga oxygen ng mga pasyente with severe and critical. So we're trying to make sure that na nare-reach natin at least more than 90% O2 saturation para po yung enough yung oxygen na pupunta sa brain. Again, it's not just stroke that is causing the changes in the brain. The hypoxemia, yung mababang oxygen po, eventually naapektuhan yung brain natin.
Okay. Now today, a lot of us have been hearing about long COVID. Dr. Ethel, is the risk still high after COVID-19 recovery? Madalas ba natin nakikita itong mga long COVID o itong mga simptomas well after the patient has become better?
Yes po. In my clinical experience, up to 1 year, meron pa din silang mga simptomas and varied, no? From head to foot po talaga yung mga post-COVID. Kaya hindi pwedeng baliwalain talaga yung COVID. Hindi siya ordinaryong infection. Kahit na magaling na po kayo, binabantayan pa din po namin kayo.
Ultimately though, strokes can be treated kapag naagapan ito and you should never delay getting the care that you need. And before we go, Dr. Epi, could you give our viewers a few more tips about how they can prevent strokes?
Yeah, get a healthy lifestyle, like do exercises, daily exercise, healthy lifestyle, healthy habits, eating habits, stay away from fast food, stop smoking, limitation in the alcohol intake, like if you need to drink 2 bottles of beer will be enough, not more than that. Get enough sleep and lessen your stress.
And Dr. Ethel, any tips para maganda ang lungs at healthy ito for the long run?
Unfortunately, there are no perfect medication to protect the lungs. I think the only way to protect the lungs from infection is our health protocols. Yung mag-wear ng mask. Kung merong mga pasyente, kung inuubo po kayo, protect the community by covering your mouth. No? You need to eat healthy. You need to exercise the same way as yung sinabi ni Dr. Epi sa atin. It will be also the advice to keep your lungs healthy. And stop smoking po if you are smoking.
With that, I'd like to thank neurologist Dr. Epifania Collantes and pulmonologist Dr. Ethel Anunuevo for sharing with us your expertise and your insights. The more we know about COVID-19 and its complications, the better for our health. So marami pong salamat sa inyong dalawa. I'm Dr. Freddy Gomez and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you again next time.